Hi, I'm Dr. Christopher Connor. Welcome to Northeast Rehab. While you're waiting for one of our providers, let me tell you a little bit about what we do here. Our team is made up of what are called physiatrists, and our specialty is called physical medicine and rehabilitation. We're medical experts who specialize in helping people manage and treat different kinds of pain. Along with pain management, our team of doctors specialize in spinal cord injury medicine, rehab from strokes, treating brain injuries and concussions, sports medicine, and using the latest technology to come up with accurate diagnosis and treatment plans. Our goal is to get you back on your feet and feeling and doing your best. My specialty is focusing on the spine and pain medicine. Something we're really proud of here at Northeast Rehab is we're made up of local physicians treating patients in the community for the last 30 years. We have 4 locations, including an office in my hometown area of Carbondale. We're so grateful you chose us for your care. Now here's a look at some of the other things we do for our patients.
Hi, I'm Dr. Cheryl Oleski, and I'm a partner here at Northeast Rehab. One of my specialties is treating people with back and neck pain, as well as helping athletes who may have suffered an injury. My focus is interventional spine and sports medicine, which is related to any joint issue that doesn't need surgical treatment. Some of our other doctors specialize in treating concussions, which is a type of brain injury caused by something like a bump or a jolt to the head. Here at Northeast Rehab, we take a team approach to concussion therapy. One member of our team is physical therapist Maria Melody Carr. I'll let Maria explain some of the high-tech tools we use and some of the symptoms of concussion.
Hi, my name is Maria Melody Carr, and I'm a physical therapist here at Northeast Rehab. I specialize in concussion treatment. I think what's important to recognize here at Northeast Rehab is that we treat our concussion patients with an entire team approach, from our physician who's certified in concussion treatment to our physical therapy department who aids in the recovery of concussion patients. Gone are the days of sitting in a dark room hoping that you recover from a concussion. But what's important to recognize now is that there is help, and especially here at Northeast Rehab. Some of the cutting edge tools that we use are pods that we place on the floor, and we use these for reaction time and memory recall. Another tool that we use is the virtual reality component, where a patient can sit and look at different scenes in hopes of aiding in their recovery. Another method of treatment is balance exercises. We also perform vision exercises. If you are someone who continues to suffer from concussion symptoms, which can include vision deficits, headaches, memory loss, dizziness, please don't hesitate to reach out for help, especially here at Northeast Rehab.
Hi, my name is Dr. Ken Gentileza. I'm one of the physiatrists here at Northeast Rehab. I'm also the managing partner. Let me share with you some of the services that we have that you might be interested in here at our practice. Let's start with something called PRP, which stands for platelet-rich plasma. This type of treatment can be used for conditions such as tennis elbow, repairing small muscle tears, osteoarthritis, and disc pain. PRP is an alternative to steroid injections because it uses the patient's own blood cells to accelerate healing in a specific area. This type of treatment can slow or even reverse the degenerative process that's causing your pain. One of the main priorities here at Northeast Rehab is the one-on-one time we spend with our patients. That's especially important with physical therapy. We make sure every patient sees the same physical therapist every time they visit. Here's one of our teammates with a look at some of the advice we give to our back pain patients.
Hi, my name is Mark Ford. I'm a physical therapist assistant here at Northeast Rehab Physical Therapy. Have you ever just got up out of bed and pulled a muscle? Has your back just hurt? Here at Northeast Rehab, we have a tip that we want to share with you. It's called the log roll method. This is what you would use to get out of bed. So with one leg propped up, you're going to roll to your side, and then you're going to drop your legs off and utilizing the same arm that you're rolled onto to push yourself up in order to keep your spine in neutral, as opposed to just sitting up out of bed. A lot of times people just kind of thrust themselves forward up out of the bed, and that puts a lot of strain on the low back. So by utilizing the log roll method, it will actually help to keep the spine in neutral and decrease the amount of effort that's required out of those low back muscles.
Hi, I'm Dr. Michael Wolk, one of the partners here at Northeast Rehab. Today we're going to talk about some of the services that we provide to our patients. One of the programs our team is quite proud of is our COVID-19 recovery program. While the worst of the pandemic is behind us, many people still suffer from long-lasting effects of COVID that can impact them physically, mentally, and emotionally. And the symptoms are more than just breathing troubles. Long-term COVID patients can experience things like fatigue, muscle weakness, cognitive and emotional difficulties, trouble moving around, muscle and nerve pain, difficulty swallowing, even gastrointestinal issues. But we can help. Our physical medicine and rehabilitation doctors will work closely with a patient's primary care physician and other local experts, including mental health professionals and the team at Allied Services. Some of the psychological symptoms we see in our long-term COVID patients include depression, isolation, mourning the loss of a loved one, guilt associated with infecting another. One of the ways we use to treat post-COVID patients is with acupuncture, but this treatment, based on traditional Chinese medicine, can be used for many other conditions. Our acupuncturist, Maria Wanzak, gives us a look.
I'm Maria Wanzak. I'm one of the acupuncturists here at Northeast Rehab. If you are a very active person, an athlete, acupuncture can be very beneficial. It helps with sore muscles, pulled muscles, and inflammation in general. It can also help if you're extremely tight and tender and if you have decreased range of motion. I've seen a lot of runners, cyclists, hikers, and acupuncture can be very beneficial to help them perform at their best.
Hi, I'm Mark Azzini. I'm one of the physician assistants here at Northeast Rehab. Patient care is so important to us here. After our physiatrists treat you and provide your plan of care, our physician assistants and nurse practitioners are here for you every step of the way. We'll help you on your follow-up appointments and whatever else you need. That may include different types of therapy, including some treatments that will help you soak in some relief.
Hi, I'm Shannon Cawley. I'm a physical therapist with Northeast Rehab, and I work out of the Greater Scranton YMCA here in Dunmore. This is where we treat both our land and aquatic physical therapy patients. What makes our aquatic therapy program special is we have access to deep water where we can do decompression or traction for back pain or other joint problems. The patients that come here do not have to be members of the YMCA. We have a lane reserved through Northeast Rehab to provide our aquatic physical therapy patients proper space for their treatment.
And aquatic therapy at the Greater Scranton YMCA is something that our patients really get into. Just ask them.
Hi, my name is Ruth Bolero and I'm from Taylor. I've been coming to the aquatic therapy. I enjoy it, it relaxes me, and it also gives relief to my back. I feel great when I leave here. I can walk a lot better and I just feel fantastic. I highly recommend it. It helps a lot.